Hi everybody, it's Dr. Hodges. I just want to talk a little bit today about regret after surgery. This is actually a common question or concern that some of my patients have, usually around the 1 or 2 week mark. And I like to think about bariatric surgery in terms of the different phases. And similar to, whenever somebody is depressed, they have the different phases of depression and the different things that patients will go through. I feel like there's something similar to that with weight loss surgery. So I think in the very beginning, when somebody first decides to have weight loss surgery, they're full of excitement. They're excited. Sometimes they're a little apprehensive. They do their research. They're very diligent. Then it comes the night before. They're excited, but they're really nervous. The morning of surgery, sometimes they're really nervous, and with my patients, I like to give them a little love, give them a little something to kind of help calm the nerves a little bit. The third phase is what I'm liking to address right now, and that would be regret. It is very common for patients after they've had an elective surgery because they're dealing with their pain from surgery, just a normal recovery. They're dealing with the change in their diet, and they're kind of looking down at their belly wondering, what did I just do? I did this to myself. I think I made a bad decision. I've had elective surgery before, and I can remember the day I woke up from surgery, the day after, I remember thinking, oh my God, I made a bad decision. And of course, I don't feel that way now. So I just want you patients to know out there that if it's before surgery and you're doing research, or if you're one of those patients that you've recently had surgery and you're wondering, oh my gosh, did I make the right decision? I can guarantee you that you have. Typically, by your 1 week follow-up, or definitely your 1 month follow-up, if you've had high blood pressure, diabetes, you're probably already off all those medications. If you're one of my patients, whenever I see you back for your 1 month follow-up, you're probably down at least 20 pounds. Once I see you by your 3 month mark, you're down anywhere between 40 and 60 pounds. So it most certainly is worth it. I want you to power through, because the last and final phase of the bariatric surgery and journey is definitely the enlightenment and the elated phase. So this is typically what happens to my patients after about the 2 to 4 month mark, where they're now getting into their groove. They're eating a more normal type diet. Their pain is certainly resolved, and they're kind of getting into the groove doing their protein, and they're doing all of their vitamins. And more than often than not, and actually with almost all my patients, I don't get the question of, why did I do this? I get the question is, why didn't I do this a lot sooner? So I wish you guys all the very best. Stick with it. You can do this, and you're going to have a wonderful outcome. Have a good weekend.